Hello everyone. Here I am going to discuss a very important topic, that is chronic inflammation, also known as granulomatous inflammation or tuberculosis inflammation. So it is a topic from which you usually get long question as well as short question. So very frequently in your university exams you get a long question on chronic inflammation or granulomatous inflammation or tuberculosis, the pathogenesis of tuberculosis, or sometimes you get a short question on the granuloma, the pathogenesis of granuloma, definition of granuloma, types of giant cells, examples of granulomatous inflammation. So we will be discussing all of them in a super simplified manner. So let's start it. Let's start the topic. You can see chronic inflammation, also known as granulomatous inflammation. Chronic inflammation and granulomatous inflammation is one and the same thing. Whether question is coming on chronic or granulomatous, you have to write the same thing. So before starting the topic, have a look. If this question coming as a long question in your exam, you are going to frame your answer under following headings. So overview is always very important, students. Please learn the overview because you have to, because you're a university, you are going to appear in a university exam. If you are going to appear in a competitive exam, I don't stress this, but you have to write your answer under following headings. Now you have to learn the headings. So first of all, tell me the introduction or definition of chronic inflammation. What is chronic inflammation? Then start granuloma. Tell me the pathogenesis of granuloma. Tell me the definition of granuloma. Tell me the structure or microscopy of the granuloma. Then tell me the types of the giant cells. Then tell me the types of the granulomas. And in the end, we will see the examples of the granulomatous inflammation. So let's start them one by one. So let's start with the introduction or the definition. What is chronic inflammation? As the name indicates, chronic inflammation. It's an inflammation which is of prolonged duration. As the name indicates, it's chronic. It's prolonged duration. So here three things takes place simultaneously. Number one, inflammation. Number two, tissue injury. Number three, attempts to repair. Three things takes place simultaneously. Inflammation along with tissue injury along with attempts at repair. So these three things takes place simultaneously because inflammation is too prolonged. So repair also starts simultaneously. On one hand, there is inflammation. On other hand, there is repair because it is too prolonged. That is the meaning of the chronic inflammation. So three things are there: inflammation, injury, and repair simultaneously. That is chronic inflammation. Now start granuloma. First you tell me the pathogenesis of granuloma. How does the granuloma form? Now I assume that you have already watched my video on the acute inflammation. If you have not watched, please watch that. This video is of chronic inflammation. Please watch the video on acute inflammation also. In acute inflammation, I told you acute inflammation takes place in 11 steps. 5 of them are vascular events and 6 of them are cellular events. Total 11 steps, 11 events are there. In chronic inflammation, only 3 steps are there. So chronic inflammation is a type of, it is the mechanism is type 4 hypersensitivity, and here only 3 steps are there. Only 3 steps. Let me tell you the 3 steps. So as soon as any antigen enters the human body, this is a non-degradable antigen. Any non-degradable antigen. For example, one of the non-degradable antigen is Mycobacterium tuberculosis, Mycobacterium leprae, talcum powder. So any non-degradable antigen enters human body. As soon as it enters, the first cell which come in contact is antigen presenting cell. It is unable to degrade. This is a non-degradable antigen now. If it was a degradable antigen, it is able to degrade it. But since it is a non-degradable antigen now, so antigen presenting cell will not be able to degrade it. So this is antigen presenting cell. This antigen presenting cell. So as soon as a non-degradable antigen enters the human body, the first cell which comes in contact with it is antigen presenting cell. Antigen presenting cell will engulf it, try to degrade it but unable to degrade it because it is a non-degradable antigen. Antigen presenting cell will try to degrade it. After engulfing, it will try to degrade it but unable to degrade it. So it will present this cell to the next cell. Who's the next cell? Next cell is helper Th1 cell. CD4 lymphocyte helper Th1, not helper Th2, this cell. So it will give the signal to this cell that we have a non-degradable antigen in our body. So this cell will get stimulated, and on stimulation, it will secrete 3 cytokines. It will secrete 3 cytokines from that. Name the 3 cytokines. You have to learn the name of the 3 cytokines. The first is interferon gamma. The second is interleukin 1 and 2. And third is TNF. The third is TNF. So these are the 3 cytokines which are secreted by helper Th1. What does these cytokines will do? These cytokines will take one cell out of the blood vessel. You can see this is the blood vessel. From the blood vessel, they will take one cell out and make a granuloma. So what does interferon gamma will do? Interferon gamma will take the monocytes out. So in the blood we have monocytes, right or wrong? In the blood we have monocytes will come out. Monocyte, once out, it is known as macrophage. It is known as macrophage. So till it is in blood, it is known as monocyte. Once the monocyte leaves the blood, it comes in the tissue, it is known as macrophage. So it will take out and form the macrophage, interferon gamma.